Welcome to The Source, where we combine the headlines with in-depth conversations with the newsmakers themselves. I'm Pinky Webb. Today on the program, amid the alarming rise in COVID-19 cases, Metro Manila will be easing restrictions, focusing on a new granular lockdown system starting September 8. The health department says the highly contagious Delta variant is now present in all regions of the country, and Malacañang maintains that the mandatory face shield policy is here to stay unless experts say otherwise. National Task Force Against COVID-19 spokesperson Restituto Padilla and World Health Organization Country Representative Dr. Rabindra Abeyasinghe join us live. Metro Manila is getting ready to ease restrictions with the pandemic task force, allowing city mayors to put hotspots under smaller yet stricter lockdowns. The task force is piloting the so-called intensified granular lockdowns in the region beginning tomorrow, September 8th, until the end of the month. Malacañang has yet to provide more details on these granular lockdowns. Meantime, the country's COVID-19 cases reach another record high on Monday as 22,415 people test positive for the disease. This is the highest ever single-day increase in the daily tally so far. Let's go straight to the source of the story. We have World Health Organization Country Representative Dr. Rabindra Abeyasinghe. Dr. Rabi, welcome to The Source. Maraming salamat po sa inyong oras.
Good morning, Pinky. Happy to be here. Thank you for the opportunity.
All-time high, Dr. Rabi, at over 22,000 cases, to be exact, 22,415. In fact, looking at the average the past week, that has gone to about 18,000 a day in the past 7 days or so. How do you think government is faring in its COVID-19 response?
Thank you for the question. It is a very important question in the current evolving situation. The Delta variant has caused the overwhelming of healthcare capacities in many countries as it started spreading. The countries that were spared from such a situation were those countries that were able to vaccinate very large proportions of their elderly and comorbid populations ahead of the transmission of Delta variants in their communities. In many other countries, we see very large numbers of people being infected, and this is largely related to the higher transmissibility of Delta variant. We knew that such a situation will happen, and it is happening now. The Delta variant is becoming the dominant variant globally and spreading. It already is confirmed in more than 165 countries. So the key for this was in anticipation to vaccinate as many of the elderly and comorbid populations and to expand the healthcare capacities. So the strategy was that if you have the most vulnerable people who are at risk of developing severe disease vaccinated, we could prevent potential overwhelming of the healthcare capacities. And then, of course, expansion of healthcare capacities and access to oxygen therapy were critically important. So if we look at how the country has fared, from August last year, when you had about 1,500 critical care beds, that capacity has now been increased to almost 3,800 ICU beds. This is phenomenal because it's not just a matter of adding beds. It needs to be accompanied by the training of healthcare workers and the deployment of healthcare workers. And from that respect, significant progress has been achieved in the Philippines. There are still areas that could be better utilized to manage the evolving situation. That is also making sure that the correct patients are occupying the hospitals. Because if you have mild or asymptomatic positive individuals who are at low risk occupying hospitals, then you have less room for those who really need hospital and intensive care accommodation and treatment to get into hospitals. And that creates a situation where there are long waiting lines to get into hospitals, and that leads to worsening of individual patient conditions. So as we work to expand the capacity, it's also incumbent upon the authorities to ensure that the correct type of patients are occupying those hospital beds. They are being referred at the appropriate times, both upwards and back referrals when their condition improves, so that they can be better managed in lower level facilities, and the level 3 facilities are reserved for the really critically care or severely sick patients. So, and of course, as I mentioned right at the beginning, we still need to really focus on increasing our vaccine coverage of the elderly and comorbid populations, because these are the ones who are more likely to develop severe disease. We know that 70% of the deaths in the Philippines have affected people above 60 years of age. So if we can protect them, and we know that the available vaccines, all of them, all of the WHO EU listed vaccines are capable of preventing severe disease and death. So by vaccinating those priority groups, we will prevent further large numbers of people developing severe disease from the most vulnerable groups. That's what we've been advocating to. Unfortunately, the uptake of the elderly populations in the Philippines has not been extremely favorable. Right now, we are only at about 48% coverage out of an estimated 8 million population. We've just vaccinated over 4.5 million people. That means we still have a long way to go, although the coverage is different across different regions, and particularly in NCR, we are having relatively good high coverage with about 77%. But there are regions where we are seeing the Delta variant present, and yesterday's confirmation that the Delta variant is now in all regions puts all elderly patients, wherever they are residing in the Philippines, at risk. And the need for us to prioritize vaccinating them is critically important, because out there are regions where the coverage of elderly ranges from 20 to 40%, and that is completely unsatisfactory at this point of time. So we need to have a priority push to vaccinate the elderly and protect them from developing severe disease and dying from this condition, preventable now.
Which is actually still the goal of government, to really vaccinate the seniors and the ones with comorbidities. But in summary, Dr. Rabi, are you saying that in spite of the numbers that we're seeing, the Philippine government has been faring well in its COVID-19 response? Is that basically what you're saying?
It's a matter of relativity, Pinky. We need to look at it from the healthcare capacities. We need to look at it from the population size. We need to look at it from the complexities of the topography of the country. And so, yes, we continue to say that much more can be done. But in comparison to some other countries who face the full brunt of the Delta variant, the Philippines, of course, has so far been doing well. I'm saying so far because we are not we don't know whether we are still past the height of the Delta variant's impact in the Philippines. We're seeing continuing increasing numbers. There are projections which could point to even higher numbers. So that means that the system is going to come under more strain. So there is still time for us to do whatever we can to manage that and prevent that happening.
And which actually really leads me to my next question. Basically, you're saying relatively compared to other countries, the government is faring well. However, when you look at two factors, number one, the hospital utilization, you're right that the number of ICU beds have actually increased. In fact, looking at the numbers of the DOH, ICU beds in total in the whole country is at 4,200. However, let me focus on Metro Manila, which is NCR, it has a 73% utilization rate, which is described as critical. But Dr. Rabi, I'm sure you have heard and seen the news that people here in Metro Manila have been going and hopping from one hospital to another, trying to look for a facility that will take their loved ones in. In fact, there is this perception that there may be some sort of disconnect with the kind of number, the official numbers that the DOH is releasing to what is happening on the ground.
This is, I agree with you. This is also from our observations. This is what we see in the media. This is what we hear from the people, that accessing healthcare facilities in the NCR and even in some of the other regions is becoming a challenge, even though the data shows that there is still space and the occupancy rates are in the 70s, 76%, I think, yesterday. But this then opens the door for our next critically important aspect of the response, because if we are now considering moving from a very stringent quarantine to a more relaxed quarantine with very granular lockdowns, which is something that WHO advocates and supports. But the critically important element is that those granular lockdowns, those actions need to be influenced by very accurate, very up-to-date data, because otherwise we could end up in a situation that the granular lockdowns don't give us the results that we need. So it is critically important that we have validated up-to-date information on patient numbers, on testing positivity rates, on severity of disease, on the clusters of cases. Where are the clusters? Where do you do the granular lockdowns? Because oftentimes we hear of granular lockdowns happening where people are residing with no investigation on where the actual transmission is happening. It's important to focus on where is the transmission happening, and that information can only be generated through good, strong contact tracing, which has been characterized as the weakest wing in the Philippine response. So for us to do effective granular lockdowns, that needs to be based on very good epidemiological data so that we can maximize its impact. This is our message. We need to have updated, accurate information so that the granular lockdowns, as we shift to them, can bring us the desired results, because we do recognize that large-scale lockdowns have negative impacts on the economy, have negative impacts on the ability of people to earn their daily bread. So doing granular lockdowns is something that WHO has been advocating, but for that we need to have very accurate, up-to-date data that drives those lockdowns, and the lockdowns need to be done in a way that we actually prevent continuing transmission. We break the chains of transmission.
So it seems right now what you're saying is that you are in support or in favor of these granular lockdowns. However, there has to be tight, serious monitoring. But we need to discuss that, two things, especially on that testing and contact tracing, which you had touched on a little while back, but we need to take a very short break. The Source will be right back. You're watching The Source on CNN Philippines. I'm Pinky Webb. Our source today, WHO Country Representative Dr. Rabindra Abeyasinghe. Dr. Rabi, just quickly wanted to talk to you about testing. I already know that you're saying contact tracing is really a serious concern, and we have to have a universal data and a universal contact tracing. And there are really 1,001 questions why until this day we don't have one for the whole country. But testing, we are at 73,000 yesterday. Experts are saying we should be testing at least 100 or 120,000. The reason for this is because if we do not test, we do not see the people roaming around who are possibly infected with COVID-19. How would you describe the country's testing capability 1.5 years later?
So we acknowledge that the testing capacities has increased. We have now about 275 labs. But if we look at the actual utilization of those labs, our assessment is that we are not even using them at 50%. We can do much more than the 70,000 tests that are being done. So, but the issue is that the testing needs to be used as part of the overall strategy. Just random testing or testing of very close contacts does not give us the full benefit of the testing or the investment in testing. So it's the symptomatics, it's the ones that we need to identify clusters that need to be tested, as opposed to testing the very close contacts. The very close contacts, we would advocate for them to be quarantined anyway, because we are dealing with a very transmissible Delta variant. And if you have Delta variant in a house, it's very likely that most people in the house would need to be quarantined. There's no point testing them. So we are advocating for testing to be part of the entire response strategy and integrated into that, so that the testing facilitates efficient contact tracing for identification of clusters and avenues of transmission, so that granular lockdowns can play their part in actually breaking those chains of transmission and suppressing transmission. Thank you.
What about booster shots? There already has been a report and data coming from Thailand, if I'm not mistaken, that after 6 months, especially with the Sinovac, I'm talking about Sinovac, which is a majority of the vaccines procured and donated here in the country. At 6 months, the efficacy actually wanes. Is the WHO already recommending to, particularly healthcare workers who were the first in line and the seniors, to get booster shots, because they may be reaching the 6-month period wherein the efficacy of the Sinovac vaccines will start to wane?
So let me be very clear, Pinky, that the position of WHO is that when we advocated the use of COVID vaccines, we said the COVID vaccines can prevent severe disease and death. The COVID vaccines were never assumed to be capable of preventing infection. What we are seeing in breakthrough infections in vaccinated people are largely mild disease, and the vaccines were never meant to prevent that. What we know is that those who are vaccinated are protected from severe disease and death. The only exception is that there is some emerging evidence that in the immunocompromised, in the elderly, senior citizens, because of their weak immune systems, the immunity is waning and they could be vulnerable to severe disease again. And that is why we are saying there may be a need to give a booster shot, but that is to immunocompromised people. It's not to healthy people who are part of the workforce, who are part of being fully vaccinated. This is because we still recognize that our vaccine coverage is low in the country. As I mentioned, there are more than half the elderly population in the country who have not received even one dose. In these circumstances, as much as WHO says that globally we don't encourage the booster doses, we'll be repeating the same thing within the country if we advocate for booster doses for particular groups who are not at risk, right? The breakthrough infections, we know they will happen. Whatever the vaccine, whether it's Sinovac, whether it's Pfizer, whether it's Moderna, breakthrough infections are known to happen. And we have to expect that, especially with the variant like Delta circulating. That shouldn't be a cause for concern. The cause for concern is if we are seeing more severe disease in vaccinated, and that we haven't still seen.
And just very quickly, Dr. Rabi, any update on the WHO stand on the wearing of face shields?
In a situation where the face shields are considered an additional layer of protection, and the country yesterday reported the highest ever number of cases, I think we shouldn't be even talking about changing the position now, because we may in the process give the wrong message to the public. So let us be very clear that we need to strengthen whatever we are doing now to strengthen the response. We can look at that once we get this situation that is currently prevailing under control, so that we don't confuse the people by saying this or the other measure is not indicated now. That is the big danger. The actual efficacy of a face shield WHO has mentioned that it's primarily meant for healthcare workers in facilities in where aerosol generating procedures are happening. But we have, as a country, decided, you have as a country decided that face shields should be worn. So we shouldn't change that position now when the country is experiencing the highest number of cases. That would send the wrong signal to people.
WHO Country Representative, Dr. Rabindra Abeyasinghe, thank you so much for your time and take care of yourself.
Thank you so much, ma'am.
Thank you. And coming up, more on the granular lockdown system. COVID-19 Task Force spokesperson Restituto Padilla will be joining us after the break. You're watching The Source on CNN Philippines. I'm Pinky Webb. Our source today, COVID-19 Task Force spokesperson, retired General Restituto Padilla. General Padilla, welcome to The Source and maraming salamat din po sa inyong oras. Let me already start. MECQ ho tayo ngayon. And of course, it's come out in the news that bukas po ay GCQ na. Sigurado na ho ba ito?
Yes, there was an announcement na nung kagabi, sinabi na rin ni Spokes, pero subject to final approval ni Presidente. Pero I understand that this will push through to give way for the pilot test of the granular lockdown that has been announced. But no implementing guidelines have yet been issued, and we anxiously await what this will be.
Yeah, I think there's also a meeting with the mayors today, together with obviously the Chairman Abalos. But if we shift to GCQ tomorrow, does that mean that all the establishments that were closed under MECQ will now open tomorrow, such as salons, restaurants, and even religious activities? Kasi pinapayagan po yun under GCQ.
Yes, but subject to certain restrictions, and I'd like to review them. So tingnan lang po natin sa food preparations, mga establishments like restaurants, pinapayagan na po yung dine-in at 20%. Tapos yung alfresco, 50%. So 20% lang po pwede sa loob, 50%, 50% para sa mga alfresco type. Yung mga nasa labas kasi may ample circulation po yan. Tapos sa personal care services, papayagan na rin po ito. Ito po yung mga beauty salons, mga barbershops, nail spas, and the like. No? Pero 30% lang po ng capacity ang papayagan. At hindi po pwedeng dagdagan pa dyan para maging safe po sa lahat. Ang mga meetings, incentives, conventions at saka mga exhibitions, hindi pa rin po pinapayagan ito. Ang outdoor tourist attraction, pinapayagan na rin po pero limited din to 30% and under the strict adherence to the minimum public health standards. For those establishments that were issued safety seals by the DTI, the LGUs, and related agencies, meron silang privilege na magdagdag ng plus 10% sa kanilang capacity dahil ang kanilang sistema ay nagbibigay daan para sa mas maayos at mas safe na pag-conduct ng business nila ayon dun sa ginawang safety seal inspection. So sa indoor sports, hindi pa rin po pinapayagan. So hindi pa rin po ito papahintulutan. Ang staycations naman po in certain areas, pinapayagan na. Ang travel sa interzonal ay point-to-point para sa karamihan po ng atin, ng mga kababayan para sa GCQ to modified GCQ, pwede po yon. Pero subject to the LGU requirements ng pupuntahan yung destination. Dahil may
what about religious activities, LGU, General?
Depende po sa kanilang condition na ayusin ito. Sa religious activities naman, yes, pinapayagan na rin po, pero 10% lang po, subject to increase to 30% base ho sa findings ng LGU. So nasa LGU po yung karapatan na itaas final ito say. Kung nakikita nilang okay naman.
But General, sigurado na po yan tomorrow? Yan yung mga indices sinabi nyo at a particular capacity. Is that confirmed that will be allowed tomorrow or pag-uusapan pa rin po ito today?
Ang alam ko po pag-uusapan today ng ating mga Metro Manila mayors ay yung implementing guidelines at paraan para mag-implement ng granular lockdown. So although ginagawa na po ng LGU ito, meron pong ipapilot ngayon na approach sa granular lockdown na hopefully ay mas maging mainam kaysa dun sa ginagawa previously. So hintayin po natin yung guidelines. So we can expect an easing by tomorrow, transitioning to GCQ.
Okay. General Padilla, we will just say goodbye on television right now, but we will continue our discussion on our Facebook page for more details on this. In the meantime, General Restituto Padilla, thank you so much for your time, and thank you for watching The Source. I'm Pinky Webb.